Hello, I'm Dr. Mark Rosenthal. I'm a paediatric respiratory physician, and I also specialize in sleep disorders of children. And I'm here to answer questions on this occasion about cough in children. So the main types of cough in children are dry coughs and wet coughs. Dry coughs tend to occur more with asthma type symptoms, worse at night, worse with exercise, laughing and crying. And wet coughs tend to be commoner in younger children, less than 5 years old, and can be very persistent after a viral infection, and also can indicate an acute bacterial and occasionally a viral infection. However, the two main divisions is wet and dry. I always encourage parents to have recordings of coughs of their children when I see them in clinic, because they rarely cough for me in clinic, and it is not at all easy to differentiate between wet and dry, even though on the face of it, it may look obvious. The symptoms to look for, as I said in answer to the previous question, is whether the cough is wet and dry. But the other really important thing is under what circumstances does the cough occur? For example, does it occur with exercise, laughing, crying? Does it occur at night when they're asleep? And coughs that only occur when children are awake and never when asleep is often an indication of a habit or stress-related cough. Other things to look for are, is it associated with eating and drinking, especially in children under 1. Coughing after a liquid feed is always an important consideration as to whether the child has aspiration. In other words, a bit of the liquid is going into the lungs. But that is most common in children under 1 year of age. The other main issue is whether the cough is intermittent. Does the child have a period of coughing for a couple of weeks and then it goes away for a few weeks and then comes back and goes away? This is usually far less serious than a cough that inexorably persists every day without fail. These things are based on duration and severity and also associated features. If the child is otherwise very well, happy, playing, eating, drinking, etc., and coughing, it is less likely, though there are no guarantees, that the problem is of a more minor nature than persistent coughing and associated malaise. They used to run about, now they don't. They used to eat well, now they don't, etc. The coughing up of sputum, which is unusual in children under the age of 8, is always a very important feature and is always a concern that requires investigation. Other things that parents should worry about is if indeed, as in the last question, if the cough only occurs when the child is awake and not when asleep, then that can be a feature of underlying stresses, which are just as important, even if medication is not the treatment. The treatment entirely depends on what the cause is. The two commonest causes of persistent cough in children under 5 is viral related cough symptoms that persist for a long time, perhaps 3 to 6 weeks, and a persistent wet cough in an otherwise completely well child, which is unfortunately called persistent bacterial bronchitis, although is a much milder problem than the title suggests. For the first situation, There is no perfect treatment, but Montelukast and inhaled steroids are frequently used. And for the second situation, namely the persistent wet cough, possible persistent bacterial bronchitis, then a prolonged, and I mean 4 to 6 week course of antibiotics is usually highly beneficial. If one has a diagnosis of asthma, then inhaler management is of course everything, and other rarer causes, I think, need to be considered after investigation as they are more complicated. Well, I don't think you actually can. In children, almost all cases of coronavirus have been extremely mild, and coughing isn't a particularly prominent symptom. However, the Delta variant has been thought to cause more common cold type symptoms. But if it's in association with, for example, loss of taste and smell or a persistent fever, then it might be due to coronavirus, and a COVID test is always a sensible thing to do. But I don't think you're going to be able to say from the cough or its quality whether or not it's due to coronavirus. I did just want to add one thing, and that's about foreign bodies. Lots of children inhale bits of nut or little toys, or are given things by their generous brothers or sisters. And one of the characteristics of that is very sudden onset. In fact, parents can often time the onset of symptoms almost to the minute, such as 10:15, 6 weeks ago on a Tuesday evening. And that is always very important, and missed foreign bodies can cause loads of problems. So if that sort of situation arises, you need to go to hospital.